When I started studying nursing, it was just because it was a good paying job. My sister-in-law, Caitlin, was a nurse at the STICU floor for Parkview, and she talked about the hours and the money, and I said, you know, that's something that I could do. So initially when I started thinking about being a nurse, my motives really weren't the best, but that changed down the line. About halfway through nursing school, my grandma was diagnosed with end-stage renal disease. The nephrologist gave her a couple weeks to live, and after talking with our family, it was decided that she would be put in hospice care. But when I went to see her, she would talk of a nurse that made her day. It showed her compassion and made her feel safe. And that was important to our family because we couldn't be there all the time. And so that was when it changed for me. That's when I think I became a nurse. Not at graduation, not after passing boards, but in that moment during nursing school when I saw how you can impact people and their families, that was the changing point for me. The thing that she talked about the most was that he would just take time to sit with her. And I think that's hard because as nurses we're so busy we don't always get that time. But in those moments when we do, it can really mean the difference, whether it's being with somebody when they're hearing bad news or being with somebody when they're hearing good news. When I was in nursing school, my professors actually told me a lot. They said, if you're in this for the money or just for a job, you're not going to be a good nurse, at least not the best nurse that you could be. And after seeing this nurse, I realized that it meant so much more. And if you don't really have the passion that fuels that drive, you don't always make it to the finish line. And I really don't think I would have made it to the finish line if it wasn't seeing that impact that nurse had on my grandma, and then the impact that I could have on the patients that I interact with. I love meeting new patients. I think that's why I like the emergency department. I see so many people each day, and sometimes it's good and sometimes it's bad, but just the interactions with new people and getting to walk with them in some of the darkest times it's truly a blessing that I think a lot of people don't get to experience in life. Being surrounded by people that are sick and people that are dying. So it means a lot to me that I get to be in that intimate space with them and their families. Being a nurse to me means meeting people in the darkest times of their lives, and sometimes it's not the warmest interactions that we receive as nurses, especially in the emergency department, but oftentimes those are the people that need the most compassion and need the most help are the ones that aren't really seeking it. And so it's really important for me as a nurse, and it means the world to me to be there for them in those times.